Sometimes a tooth is removed, and a dental implant is not placed immediately. Without a tooth, the jawbone typically shrinks, resulting in significant bone loss. This bone loss isn't due to any fault of the individual. It's the natural resorption process that leads to bone deterioration. To have a dental implant and teeth later on, additional bone may be required to anchor the implant. There are various methods to regenerate the bone, known as bone grafting techniques. Socket grafting involves adding bone at the time of tooth removal. The tooth is removed, and bone grafting material is placed in the socket left by the tooth for a 4-month healing period. After the bone heals, the dental implant can be placed, followed by a tooth on the implant. For patients with more extensive bone loss, a technique using blocks of bone in the area of missing bone is effective. The blocks are shaped to the required size and secured with titanium screws, then left to heal for 4 to 5 months. Once healed, there is sufficient bone for a dental implant. If using a block is not feasible, a softer bone substitute mix is placed in the area of missing bone and covered with a membrane. This graft also promotes bone growth. After the bone heals, a dental implant is placed, allowed to heal, and finally, a tooth is placed on it.